Then Dr. Ahmed said, your best bet is to have a 100% match, and we're running out of time.
One patient's lifeline came from a random Facebook message. Good morning, I'm Jessica Lovell and welcome to the Morning Medical Update. Last year, a cancer diagnosis surprised Eric Moore and his family, to say the least. His best chance for survival was a bone marrow transplant, but he simply could not find a donor match. That is, until another surprise came from someone unexpected.
Eric Moore and his wife Heather have been through a lot.
I almost lost him years ago in an oil rig accident, and then he was in a bike wreck in 2020 and had a skull fracture.
Eric had cheated death before, and in 2022 was about to do it again.
His stomach just kind of started swelling.
A CT scan revealed Eric had lymphoma. He immediately started chemotherapy. Soon, Eric thought he had it beat, but within a matter of weeks, the cancer was back. He was sent to the University of Kansas Cancer Center into the care of Dr. Nausheen Ahmed.
It was just wreaking havoc on all kinds of my bodily systems, because once it got into my spine and my spinal fluid, it had the opportunity just to wreak havoc everywhere.
This time, doctors told him he would need a stem cell transplant.
Dr. Ahmed said, your best bet is to have a 100% match, and we're running out of time.
Eric went into search mode for that 1 in a million donor match that would save his life. But who?
It's almost like God was preparing us for this. He was putting all the lifeboats that we were going to need in place.
And that lifeboat came in the way of a random Facebook message Heather received just a month earlier.
And I get a message and it says, "My name is Jennifer. I'm trying to find my brother."
After not speaking for 20 years, Jennifer wanted to reconnect with her brother Eric, and so did another brother, Jesse.
It was really amazing just to get that initial, okay, so he's alive, he's, still around and everything.
It was a lot for Eric and his family to digest, but Heather had a thought.
And then with talking with his wife, Heather, had to learn, okay, he's battling cancer, and then it was, hey, do you guys want to try this to see if you're a match on the stem cells? It was a couple-week process between finding them, making that contact, and then the initial ask of, hey, are you interested in giving this a shot?
And within 2 weeks of reconnecting, Jesse was on his way to Kansas City to donate his stem cells to Big Brother Eric without hesitation.
Not at all. It was only that much more because it was my brother, but I mean, if I had a chance to help somebody have a better life, I'd choose the same thing.
It's someone throwing you a lifeline that doesn't have to. I'm grateful.
Now in complete remission, Eric is hopeful cancer is behind him. As for his newly found family, that story to be continued.
And we are so happy to have Eric Moore and his wife Heather joining us remotely this morning. Heather, Eric, good morning. How are you?
Good morning. I'm doing great.
That's what we like to hear. So good to see you both. Here with me in studio also, I know you're happy to know, we have Dr. Nausheen Ahmed, a hematologist and medical oncologist, also the Assistant Director of Cellular Therapeutics at the University of Kansas Cancer Center. Dr. Ahmed, how are you?
I'm good.
Good to see them both, right?
It's like a reunion.
I love a good reunion. Dr. Chris Leminska is a radiation oncologist also at the Cancer Center. How are you?
I'm doing well, thank you.
Good to have you at the table. And also, this is kind of the gal who puts this whole thing together. You make it, you get the plane off the ground. Shalene King is an RN and pre-transplant bone marrow transplant coordinator here at the health system, and we're really excited to see how you pulled this one off. So glad to have everyone. Eric and Heather, let us start with you. Eric, so you got the lymphoma diagnosis last year. I asked how you're doing. You said great, but how are you really feeling since going into remission?
How are you feeling since going into remission?
I would say 95% better. It's still physically a struggle trying to get my body back in shape and up and running, to pre-cancer. but it's definitely doing a lot better.
Good to hear. And Heather, thank you very much. I know that Eric has a little trouble hearing, so thank you for translating what I'm asking. Because Eric, I do want to ask you, you went through so much chemo. A lot of that was in Wichita. Then you came here to KU. Heather, what was it like watching him go through that? What was this like for you both as a couple?
It was difficult. I don't think you realize until you're going through that with someone just how hard chemo and radiation and treatments like this are on your body. And when he started getting the first round of chemo in Wichita, just shortly after that, I actually got COVID, and I couldn't be there with him for a little while. And when I came back, I remember getting him into the shower and helping him and washing his hair, and just, chunks of his hair coming out in my hand. And I think that's when it really set in what we were getting ready to go through. And then, the last rounds of chemo were really aggressive. And it's hard to realize that, the things that are going to heal him and that are going to make him better are also going to make him worse in a way for a little while.
Mm-hmm. And thank you for just being honest and describing that moment in the shower, because this is what so many families go through. So Eric, tell us, what was it like when you learned that the cancer was back?
It was kind of emotionally, it was a struggle, because at first you think, okay, you get your diagnosis and, it's not something people live through. Cancer is something that takes people out. You don't hear recovery stories so, just to get the diagnosis at first was devastating, to say the least. It took a little bit to mentally get back onto a foot to where you felt like, okay, this is something that is doable. This is something that I can overcome, that, it doesn't have to end in defeat. It can be put into a rest and remission is possible,
Yeah. It's truly the good, the bad, and the ugly. Part of that good, though, was ringing the bell. You captured some video. Let's hear that bell ring. It seems like such a simple moment, but we always say we never get tired of hearing that bell ring. Eric, what was it like? What do you remember from that moment, knowing that you had reached that huge milestone?
What do you remember from that moment when you rang the bell, when your radiation was done?
Relief, because radiation for me was kind of rough. I didn't deal with it very well. So it was almost like a weight being lifted off your shoulders, that you felt like, okay, this is a race that I'm going to be racing for a long time, but at least now I'm halfway through it.
You're on your way. I have to ask you, you found Jesse, as we mentioned this story. It's that we could do a whole show on that, because that was such a remarkable way and really right in the nick of time that you found your donor match through Facebook. But what was it like just reconnecting with your brother?
What was it like reconnecting with your brother?
That was awesome. That's something that I had kind of distanced myself from for a long time, just because this is my life, that's your life, and I didn't necessarily see that there was a desire to reconnect. Just so far, so much time had passed that that relationship was done. So it was really nice. It was one of those awe moments.
Yeah, for sure. If you don't believe in a higher power, this might be the time. Something just bringing this family back together. Heather, you shared some photos from just this past Easter, the big family getting back together. I know you all are making up for lost time right now and just trying to reacquaint yourselves and learn about each other. What memories do you hope to make moving forward now that Eric's doing better?
Well, I think for me, the most exciting part of that was we all have kids, you know, and watching the kids get to meet their cousins and get to meet their grandpa for the first time, and aunts and uncles. And, you know, you can never have too much love in your life. You can never have too much family. And so that, you know, just making that connection and just my kids being able to have that love in their life, and then also watching my husband be able to find some peace in his life, to put some of those puzzle pieces back together that complete him.
Dr. Ahmed, I want to bring you in here because in Eric's case, chemo seemed to work, but then the cancer returned. Why is that? Is that common?
Yeah, so, hey, Eric. So his cancer was Burkitt's lymphoma, which is a relatively rare cancer in adults, for it, most of these cancers respond to chemotherapy, but then around 15 to 20% of the time, they can come back again. So relatively rare for this to come back again. And in Eric's case, it was back not only involving his body, but also his nerves, and which made it a little more complicated, and that's where we had to bring in radiation therapy as well.
But this clock was ticking. You said they were running out of time when they came back to you.
Yes, because once they relapse and get into a remission, then we have only some time before we can actually do a transplant to try to keep it at bay for a long period of time.
So you're doing a bone marrow transplant. There is a risk of something called graft versus host disease. I had not heard of that. Tell folks exactly what that is and what those risks are.
Yeah, so a bone marrow transplant using a donor cells. So those donor cells, they're good because they can recognize your lymphoma as being foreign, and so they can fight your lymphoma. That's one of the ways in which it works. But sometimes they can also recognize your body, like parts of your body, as being foreign and not being there. So that, therefore, they go and, you know, affect those organs. Like if it affects your lungs, then it can cause like a pneumonitis. Or if it affects the gut, it can cause like diarrhea. So it's basically those cells affecting the recipient, the recipient's organs.
So it's getting to the bad stuff, which we want, but it's also getting to the good stuff, which we don't like. Shalene, I want to bring you in here. You're a bone marrow transplant coordinator, a pre-transplant coordinator. Tell us your role in Eric's care and just kind of how this all comes together.
Yeah, first of all, hello guys. It's an honor to be in this role as a pre-transplant coordinator. We are brought in for to meet patients at their initial consult. We want to kind of just be their advocate, someone to hold their hand and guide them through the process and help them navigate this cancer journey that they're on and make it as seamless as possible, as painless as possible. And so when we meet them the first time, we really try to get to know them quickly, but also want to get their past. We start looking at all donor options up front. So our goal my role is to find out all donor options, and that's looking at the registry for the over 30 million people that are on BeTheMatch.com, matching Eric up with unrelated donors that are willing to donate. Ideally, we want to match siblings, so we're asking about family members. We look at half-matched family members as well. So we're looking at kids, at siblings, and it took about 3 visits to get all of the family information from Eric. And sometimes it's hard to ask our loved ones, let them know that we're in need of help, especially if different past situations make that more challenging. But it felt like it's our role to really just let's get the information, let's put that question out there, let's let the other adults make the decisions and just provide them with that information. A lot of the times I leave them with the question, what would you do if your family member came to you, or a loved one, or even a stranger came to you? And a lot of times it's an easy answer at that point. So
as Jesse said, he didn't hesitate, and he would have done it for his brother or anyone else. It can't be lost on you, though, this particular story, you know, a brother from the past comes and reaches out just in a couple of weeks of Dr. Ahmed saying, we're running out of time. What are your thoughts on that?
We were. It was really amazing. So we're messaging our donor coordinator. We're messaging a lot of people when we're meeting with Eric and Heather at each of their visits. And it's me talking to the donor coordinator who said, I just found out Eric has a brother. I said, I didn't know that. So
that's like music to your ears. Wait, there's a brother we didn't know about.
It is. And we have a collaborative team. We meet every week to review new patients and then at various touch points in their journey. And Eric stayed at the top of my list for quite some time. And this collaborative team is physicians and other pre-transplant coordinators. One of our coordinators, Jody Wilson, had just attended a KU symposium and heard about the proton therapy. And she said, what about this for Eric? So it's a collaborative, it's a team approach. It takes all of us to get this done. I have a very small role in patients in their transplant journey. So,
well, Dr. Ahmed would disagree.
I would think you have a major role, Shalene. You know, a lot of, you know, not only supporting the patients through, because it's an emotional journey too. It's not just a physical journey. It's the emotional journey, dealing with a diagnosis, not knowing anything about transplant. This is a whole new world for many people, even, you know, for many hematologists, oncologists. So just navigating through the whole process, making it easier to navigate through the health system. There's a lot more that goes on than just, hey, this is a cancer that I need to treat.
Well, and when I invited you to come on our program, you said not without these two sitting next to you, because they were a big part of why Eric is smiling here this morning, and so is Heather. I have to tell you about the bone marrow registry. It's super easy. It's just a swab, right, guys? Just a swab. They can send it to your house, and you can send it back. You can check out bethematch.org to learn more about it. It's super easy to do, very selfless thing. Become a part of that worldwide registry. And what should they expect with that? I mean, you go in, and then coordinators all over the world can contact you at any moment, correct?
Yeah, so we will, the NMDP actually will send free kits out to our patients and family members if they aren't local. And then there's coordinators that we work with when we're looking at unrelated donors. So it's a big,
swipe it, put it back in the envelope, and you send it back, and maybe you get the call. Okay, so Eric this is really interesting, because Eric was the health system's first adult patient to get a bone marrow transplant and proton therapy. Dr. Leminska, why proton therapy in this particular case?
So we met Eric as part of the preparatory process for transplant. Patients sometimes get radiation as part of their prep regimen for transplant. And in his case, we were concerned about the disease that had recurred along the craniospinal axis, the fluid around the brain and the spinal cord. And radiation can be an effective way to sterilize that area to prevent relapses, but it's a large area and it can be associated with a lot of toxicity if you treat it. And Eric was pretty beat up at that point. He'd been through a lot. Protons were a way to target that space and simultaneously protect the adjacent healthy tissues. So we were able to treat that axis, and we were able to protect his heart, his lungs, his esophagus, his stomach, all those kind of healthy tissues that needed to be preserved so he could go through the transplant process in as healthy a position as possible.
And as we say, he's the first adult patient. That is to say that this had not been done before. What were those conversations like to know that this would be a good time to start?
So the technology was something that we had started employing. We had actually used it in children before. Eric is a relatively tall guy, so this is translating something that had been used on, a field that might be a foot or two long to, 3.5 feet, and that involved working with physics and kind of scaling up those programs to make them adult-sized.
Be sure to ask your questions to any of our panel members here, or Eric and Heather. You can use Facebook or YouTube. You can tweet us or email us at the Medical News Network. Your information is right there on the screen. Let's get a quick COVID count from Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. Happy Monday. How are you?
Yeah, it's good. Hopefully it warms up just a little bit.
I know.
Yeah, right now the COVID count is getting better, 32 active. 32 total, but 17 active, which is down from the low 20s last week. Of those 17 active, 3 in the ICU and 1 on the ventilator as well.
All right, Hawk, new numbers from the CDC last week show sexually transmitted infections are becoming more common in the U.S., specifically chlamydia, gonorrhea, syphilis. The numbers are trending, as we now see, in the wrong direction. And some of these situations, like syphilis, can put newborns at risk. Just what are your thoughts on that?
Yeah, that's exactly right. So again, more things than just COVID-19. These sexually transmitted infections, or STIs, do affect a large proportion of our country every day. What we have seen is this is data that the CDC released from 2020 to 2021, so it's a little bit behind. But unfortunately, just as you said, the trends are going in the wrong directions. Just seeing an increase in those cases, and even they just don't affect the person that's infected, as you had talked about. Also, congenital syphilis, which affects babies and can cause stillborn babies as well. And so overall, these numbers are increasing. It is not good. It is certainly multifactorial. That's why we need to continue to fund public health facilities, free clinics, increasing access to our communities. And we know that certain communities are harder hit than others as well, and that includes lower economic communities. We know the Black African American communities are hit disproportionately harder, as is the gay, bisexual men, but also our young people as well. So there are a number of communities that we need to continue to target to help increase access and surveillance for these so we can get these diseases treated.
Any reporters with us today? Let's get to some community questions. Ruth Ellen wants to know, good morning, Ruth Ellen. She wants to know what has changed since bone marrow transplant for this type of cancer since the 1980s. She says that they lost a nephew around that time from this type of cancer. What's changed?
Yeah, so hello, Ruth. Yeah, several things have changed, starting from the chemotherapies that we use, the way we monitor for the side effects and manage the side effects of the chemotherapy. So there's a lot of advances that we have made in stem cell transplant or allogeneic transplant over the last decades. Even the donor options are now wider. Like before, we would not. Now we can use half-match donors as well. So. And then management of graft versus host disease, which we talked about. So we have more sophisticated medicines and techniques to manage graft versus host disease and other complications of stem cell transplant.
Rachel wants to know, can a 50% BMT match work? You said Eric needed a 100% match. What if he couldn't find one? Would you have gone with less, or is it 100 or nothing? For survival? That's
a great question, Rachel. Yes. So we do use half matches, which is the 50% match, a haplo match, which can be children. Most of the time, children would be half matches. Sometimes siblings. Whenever we have a case, we always look at our best options. So the best option in Eric's case would be a fully matched donor. And then there would also be haplo options, but again, every case is individualized. So a half match would certainly be an option, and we would have to pick out of all available options.
Elsie wants to know what Eric thought about the proton sessions, the proton therapy sessions.
What did you think about your proton therapy sessions?
I wasn't really cool with those at all. I thought at first it was no big deal, but then we got the helmet thing strapped on for that first time, and I didn't deal with it all that well. It was scary.
It was stressful, but I do have to say that, especially that first treatment that they started, Dr. Leminska was there standing by the whole time. And when his stress level went up and he was having a hard time kind of dealing with that, he was right there in the room talking us through it, seeing, what options. He knew how important it was for Eric to get this radiation. And, that's an amazing team there in that department. They're prepared for all those kind of situations.
I don't know if we could bring up that photo, because I think, Eric, you have a photo where the mask that goes on is on his leg. We don't have that picture, but Dr. Leminska, in all fairness, people don't complain about the proton itself. It's painless, it's very quick. It's that mask that goes over their face. Explain so people at home understand what that is and why it's so important.
So part of this process is targeting and immobilization. We want to make sure that we're able to hit the target space, the craniospinal axis, and protect, as I said, the healthy tissues that are nearby. And that involves immobilizing the patient. The mask keeps you within a couple of millimeters of the same position each time. But you're under that for maybe 30 to 45 minutes for these fairly elaborate, very technical treatments. So it's a big thing to go through, especially when you're already beat up from everything you've been through up to that point. But for Eric, we knew we had a target. We knew we needed to get him to that target, and so he pushed through. He was a trooper.
Will he need to come see you for any more proton again, as far as you're concerned?
Hopefully not.
Okay, good. You can get rid of that mask. People say they take those masks and do artwork with them, bury them. They want to get rid of them. They just get it out of here, put it on the wall. It's done. Any late effects of BMT? What are there any? And then I'll ask Eric if he's feeling anything.
Yeah, so we always monitor. We monitor Eric very closely for short-term effects and as well as long-term effects. We watch for and this is why we chose proton, because we want to watch for any cardiac issues long-term, and I'm talking even decades out. Any lung issues that could happen early on or later on. Infections are another risk that we not only monitor initially, but again, even out a few months to years, also there's a risk of infection, and we do immunizations accordingly. Those are the big physical risks, really. There's many more. In fact, we have a survivorship clinic in which we particularly focus on late effects of transplants, specifically allo transplants, like really going through in detail organ system-wise, as well as mental health, like even financial situation. Are you able to go back to work? So we take every aspect into account.
Eric, what were those initial feelings after the transplant?
What were your initial feelings after the transplant? Physically and emotionally.
Emotionally, I was really relieved, because it was kind of even though it's a fairly simple process of getting the stem cell transplant, it was still, my health and my well-being, my continued life depended on if this went properly or not. So it was a little bit stressful. Physically, it wasn't so bad. It was just, I guess, the chemical they use to keep the stem cell refrigerated enough. When it's introduced into your body, it's so cold that it makes breathing hard. So it's almost like trying to breathe through a pillow or something. You feel like you're almost like suffocating just a little bit. So it was a little bit nerve-wracking.
I want to get our takeaways today. And Shalene, I'm going to start with you. What do you want folks to take away from our conversation?
I really just encourage people to go to be the match, see if you're a candidate to potentially save the life of another person through a simple process of a cheek swab. I also want people that are going through cancer journeys to share with their loved ones and share with their family, because you will need them in many ways throughout that process.
It all starts, really this whole process starts with that swab, because we need the donors. Dr. Leminska, what's today's takeaway?
I think it's just the complexity of cancer care in today's age. It's about the need for collaborative medical care. It's about the need for technology, and it's about the need for family and community.
Dr. Ahmed, what's the takeaway?
My takeaway is that there's still hope. There's hope for patients with complex cancers. We have a great team of people here, and we collaborate to try and get the best care possible to try and overcome the cancer. And I understand that the challenges are not yet over. We're still working on many things, and we'll continue to support you through this whole journey.
Thank you all. Eric and Heather, thank you so much for not just sharing your health journey, but your family, your personal family history with us. And we're so glad that this has worked out. I know you're happy to be back with your 4 kids. And Heather, I want to start with you. Just what do you want folks to take away from today?
Well, we have 6 kids and 1 grandkid.
Okay. Sorry, I lost count after 4.
Okay, it gets to be a lot. I wanted to let you know my youngest son has the mask in his bedroom now, and he has headphones and a hat on.
Perfect. I love that.
One of the biggest takeaways for this is, don't waste any more time not healing those family connections. Don't let resentments, things from the past situations of any sort come in between making those connections with your family. Like Dr. Leminska said, that family and community has been what has gotten us through this, both up there at KU and then down here with my children. They have a wonderful support system, and we're just so blessed that God put so many pieces in place for us.
Eric, what's the takeaway today?
What's your takeaway?
Don't give up. It's life is worth fighting for. Chase after every moment that you can. Don't let it slip by. Don't give up. Don't lose heart. Keep your faith.
Love your story, and I know you both are on your way up here to see us today. Is that right? Have a safe trip.
Thank you.
Bye, guys. Dr. Hawkinson, today's takeaway. Ruth Ellen has a question for you. I'm going to tell Ruth we'll ask that tomorrow because we got to scooch out. But your takeaway today?
No, it's just continuing to endorse what our guests have said. It's continuing to ask questions and seek those answers. And here at the University of Kansas Health System and with our Comprehensive Cancer Center, we have these collaborations with different groups. It's multidisciplinary. It's to help you get your questions answered and ultimately come to a final plan to get you better.
Thanks to all of our guests today, and of course to our viewers for being with us. See you back here tomorrow at 8. Coming up tomorrow on the Morning Medical Update. Imagine losing part of your tongue to save your life. Doctors had to stop cancer in one woman's mouth. I'm Jessica Lovell on the next Morning Medical Update. The complex surgery that rebuilt her tongue, plus the vaccine that stops the #1 cause of oral cancer. Tuesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.